I don't need I don't need a rewind, do I?
No, you're all good.
All right. A little bit of how our street outreach model is sort of grounded. It's incorporated in best practices. So the incorporation of harm reduction, housing force, trauma-informed care. Though I know those are some buzzwords that many of our partners here are familiar with. And also using of a by name list. So a by name list is sort of a national best practice that communities use for doing outreach, where you're not just focused on the numbers, but you're putting names to those numbers. So we're kind of doing a targeted and prioritized outreach approach. So I know that we're going to be we have a by name list that Odin is developing internally. And, I know that there's been some initial conversations about, potentially exploring how we can maybe do a by name list with partners. And then just being connected to outreach best practices. And so part of Odin's training process as he was onboarded, he's been with us for, I think, about 6 to 8 weeks now, but the first 2 to 3 weeks, he was going through some pretty rigorous training from not only the best practices that we mentioned, but he actually has visited about 4 different outreach teams through Southern California, learning about sort of different best practice models that they have and how to incorporate some of that into our community here. And just one thing to sort of mention too, as well, is that some of the models that he had an opportunity to shadow with are models that have been heavily informed by Ian DeJong. I don't know if many folks know who that person is, but he's sort of a national homeless services expert that has helped kind of develop standards for outreach and sort of best practices within the outreach programs. A little bit about the objectives. I mentioned earlier that one of the objectives that we have of outreach is to continue to uphold the conditions of the conditional use permit. So neighborhood outreach, making sure that we're providing that presence in sort of the streets and areas that are outlined in the CUP, as well as doing the neighborhood watch and patrol. And so what this means is, as I mentioned earlier, we're not going to be able to enforce, but we're certainly going to be encouraging people. But where we will have a little bit more say so, and what the conditional use permits really wants us to ensure is that any current path clients, that they're following the code of conduct set by the building. And so being good neighbors, making sure they're not loitering, that's going to be part of what Odin's going to be doing while he's doing street outreach as well. I mentioned earlier the development of a by name list, so I won't spend any more time kind of talking about that. Another role that Odin will be having is entering people into the coordinated entry system. So what's the importance of this? We know that shelter is one outcome that folks who are unsheltered can have when being connected with outreach. But we also know that some folks aren't interested in congregate shelters or have some concerns with being in congregate shelters, or maybe just have some distrust with some providers. And so, making sure that we're getting people still plugged into the coordinated entry system. So regardless of their shelter status, that we're queuing them up for a permanent housing solution. So that's going to be one of the other things that Odin will be focused on. Access to all eligible services at PATH. And so what I mean by this is that the sole purpose of Odin is not to get people into PATH shelter, because we know that sometimes PATH might be full, or they may not be interested in PATH because of rumors that they might have heard in the community, right? So then Odin's goal will be to get them connected to maybe other services that are also available at PATH that may not necessarily just be the shelter. Linkages to other homeless, medical, mental health, and alcohol and drug services. I think I touched on this earlier, that if somebody expressed interest in wanting to get SED behavioral health treatment, that Odin's going to be supporting them in that. And then, coordinating services with community partners, which Catherine's going to be talking a little bit more on a little bit later, about making sure that we are having a true coordinated approach with how we're doing outreach, and that we're not duplicating efforts, right? There's no point in Odin spending a significant amount of time with someone when we know that maybe Al has a strong relationship with the same person. So maybe we're coordinating care there as opposed to kind of duplicating our efforts. In terms of what we have seen so far, in the short period that Odin has been doing outreach, I think it's been probably about 3 weeks since he's hit the floors running. There's 10 individuals that are currently on his caseload that he's actively working to get document ready. What does document ready means? It means that in order for them to be able to move into any housing resource, that they need to have their documents in order to be able to do that. He also has 40 persons engaged. It means that they're not necessarily on his caseload, but he knows them by name. He knows who they are. There's some lighter touch services that are happening and being provided to those individuals. He's already linked individuals to both PATH and Salvation Army's interim housing programs. And one of the stories that I think is really cool that kind of really shows the benefits of coordinating and partnering with folks was that the Rangers have already reached out to Odin to let them know when sweeps will be occurring. There was one sweep in particular that when Odin knew it was going to be occurring, that he had actually reached out to a woman that had a pretty large encampment and spoke with her and talked to her about what was going to be occurring to make sure that she was avoiding losing all of her belongings. Within that period of time, Odin was able to help her identify family members that might be in the area, helped her reconnect with family members that she's been out of touch with, and were able to move all of her belongings as well as move in with the family member. And so really kind of a really cool success that didn't require a lot of monetary assistance. It was just helping people, problem solve through a sort of a situation that they're in, especially when they knew that if they didn't move quickly, they were at risk of their belongings being taken in the sweep. So family reunification, that's part of what outreach also does. And what we mean by that is, helping people reconnect with their support system and loved ones. The other thing that Odin has already done and he's continuing to do is to introduce himself to the business neighbors. And so if your name isn't on here, reach out to Odin because he wants to be in regular communication and touch with you. As we look forward, what you can expect from PATH and what you can expect from Odin is that we're going to continue to provide this group here in our community briefings on what we're seeing, what we're doing. We're going to be sharing our performance outcomes, talking about the success that we're seeing, and maybe talking about some of the challenges that we're seeing to achieve some of those outcomes. We'll be sharing success stories with you, sort of as, just like what we just did a second ago. And we're going to continue introducing ourselves and maintaining our communication with our neighbors. So I'm going to pause there to see if there's any comments or questions. Very cool. Okay. We're like I said, we're very excited to have Odin. He's already just been a wonderful team member to have on board. And so we look forward to all of you getting to know Odin as time goes. And then just lastly, in terms of hiring updates.
Excuse me, this is Sebastian. I don't have the full hour. I don't have a full hour today. Could I just make a comment?
Oh, sure. I thought you were clapping. Go ahead.
No, I was waving my hand up. I just want to mention on Cacique and Alisos, right there that would be the southwest corner. The city, they went over there, they cleaned up, but this morning there's a few gentlemen with their bedrolls in the landscape, along with a cart and other stuff right by the Cacique underpass. And then yesterday, right at the Cacique underpass, there was 2 bedrolls, a big mess. There was a big mess on the west sidewalk on the Milpas underpass, and then also the shopping center, which is that'd be the southeast corner of Milpas and Cacique. There's a Mexican bakery. There's a panhandler outside. There was somebody laid out in front of the sign, and there was 2 other gentlemen sleeping on the property. So that's Veronica Bakery. I did reach out to Barbara Anderson this morning when I went by. The Cacique underpass was cleaned up, so that was great. But the mess that's on Milpas, right up the off ramp, that's not taken care of. And so I would just like to have the Cacique and underpass on your radar along with Milpas, Alisos and Cacique. That would be the southwest corner. You know, that's been a problem area. And then as far as the businesses, I think you should talk to Alan Ramirez, which is right next door to Path. I know he has plenty to say. And then if you could stop by the Veronica Bakery. I think for whatever reason, they don't get involved, they don't call, but there's an issue, a major issue there. So, and myself, I got to get back to work. I just wanted to mention that. And thank you very much, Barbara, for taking care of business yesterday.
Thank you, Sebastian. And just to kind of respond, you know, we're definitely connected with the Ramirez's, and we're actively working to connect Odin with them as well. I see that Odin was taking notes of the areas that you mentioned so he can also kind of go by there. So I think that's kind of what we're hoping for too, right? Is communication as well, because we know that sometimes people may not have been there yesterday, but they're there today. And so making sure that, you know, that we have kind of ears and eyes to the ground. So thank you.
Okay, very good. I'll reach out to Odin when I have some time. But
and Sebastian, Joao has those areas on the radar as well. And so we've been regularly picking up items, litter, large debris removals, obviously items for sleeping. We can't enforce that, but we can enforce a sit lie. So Joao, I know you're nodding that you've been doing regular routes daily, but Lieutenant Katsapas, do you want to speak to the sit lie enforcement in that area as well?
Sure. Yeah, there's certain portions obviously of that Milpas corridor that fall under sit lie, but I think it's important to remember that if you read the sit lie municipal code section, it requires a warning in place prior to enforcement, which means that an officer can't go and strictly enforce that section for somebody in sit lie violation without first providing them with a warning that they can't be there and providing them with time to move. And that requires a warning in place for every spot that they wind up in. So that section is enforceable, but it does require that nuance. And typically what we end up getting is voluntary compliance to move once we give that warning. So, but we're, that is part of the daily route for the SCU officers. In fact, they're there probably multiple times a day. But I did as well take some notes. Dwight Murphy actually came up at yesterday's downtown and waterfront wrap. And so we will continue to be in that area, and any specific complaints, if you arise, you can always send to me either through via email or over phone or through a RAP meeting, and we'll definitely get on it.
okay, good. So I guess on the Milpas on the west side, well, they must have got their warning yesterday because they were there again today. So, but that's good. At least they got their warning. We'll be in touch.
Yeah, no worries. Another thing that I think has recently come up, and it's worth taking a look at if you do follow court decisions. There was a important court decision out of Grants Pass, Oregon recently that the Ninth Circuit Court put out regarding their camping ordinance and enforcement. And we're still, I think, on the law side, figuring out how this might impact some of the things that we do. We haven't really gotten any super clear direction on it from our city attorney's office, but it's worth looking at if you're working in the realm of the unhoused populations and some of the enforcement and stuff that's going on in the legal system.
Okay, thank you very much. I gotta go. Thank you, everybody, for doing good
Thank
work.
you, Sebastian.
Okay,
Sebastian.
take care. Bye-bye.
All right. And then Jonathan, there was a question in the chat that I think with PATH and all the work they're doing statewide, you might have better insight of what is the cost per person and manpower involved for each person getting off of the streets.
Sorry, I was trying to unmute. What is the cost per person? Sorry, I didn't see the question.
Just
That's kind of it's a tough question to ask, Natasha, because I think it's kind of a multi-layered question. What is the cost per person and manpower involved is kind of contingent on what the structure of an outreach team looks like, and the number of people that are involved. And so what I mean kind of by that is, you know, if you're asking for what the salary is for a staff person, we can definitely kind of share that and kind of break down, you know, the costs associated with having an outreach team, because I think in addition to having an outreach specialist, ideally you also want them to have access to flex funds. And what flex funds do is they allow for an outreach specialist.
Hey, good morning. I'm doing fine.
Oh, Sebastian, you're unmuted.
I was able to mute him.
So they allow for you to use that money maybe towards buying food or buying or purchasing for like documents they might need, such as a social security card or different things like that. So there's a number of costs associated with it. You know, so it's kind of tough to answer that. But those are some of the factors that go into you know, what the cost is for the program, and then you would have to divide that by the number of people that are served per year with a positive exit. So you know, I think we would need a little bit more time to see what that would look like.
Can you put that together?
I think I could put it together based on other programs. I think it's too soon to put it together based off of this program, but I think that might be a good conversation to have as a sort of a larger community with some of the, you know, with some of the factors of the outreach teams, because I think we got to kind of compare apples to apples as well.
Yeah,
I think it also, oh, sorry, just to jump in, I think it also depends on the team that's serving that person and the severity of their needs. I think Jonathan would probably be able to put out a cost per person for PATH, but if they're working with the multidisciplinary team, we would also have to coordinate with behavioral wellness and calculate their, you know, salary and hours per person that they're housing. And then are we putting that person into a shelter or into rapid rehousing or permanent supportive housing? How many interactions have they had with the emergency department? How long did they spend on the coordinated entry list? The list goes on. And so I think cost per person to get someone off the street is a little more complicated than just asking a single agency what their cost per person to get someone off the street is.
yeah, I think these are the resources that are allocated in times of manpower and costs and different agencies, I think is something that we need to have a conversation about. And if you've got an organization like PATH, you should be able to grab their numbers fairly easily. And I've been trying to find where those numbers are. It should be available publicly. I can't find them. I'd like to know. We should be able to take, you know, the entire PATH budget, take the number of people that have been helped over a year, and then have different numbers broken down per area as well. That should be easily available. I can't find it anywhere. I'd like to see it.
Yeah, and that's something that we do have for the grants that come through the county, but each agency is you know, funded by state funding, federal funding, county funding, philanthropic funding. But I can put a link in the chat right now that'll take you to the COC board documents, and we regularly review contract data at the end of contracts, and then also on a quarterly basis. And so you can explore in there to see those quarterly reporting.
And Jet, you have the county data dashboard ready for people to go into, right?
Absolutely, that's public, and I can put that on right now. And while that's not tied, that doesn't show funding, it does show the number of people, the demographics and the number of people who are moving through each agency into housing. So I'll put both of those links in the chat right now.
So Natasha, you can actually filter by agency in terms of grant funds received by the county continuum of care and the number of individuals served. And a couple of other metrics that I think are very informative overall, but you're right in terms of individual organizations and their 990.
Great, thank you.
There's a comment in there. I want to address that. I think while Jonathan reviews that comment there, well, thank you. It was really nice for everyone now to meet Odin and kind of have his information on hand. So as we move forward with outreach efforts on the east side, everyone kind of has that point of contact as well. And then I think one question, or let's just jump into the scheduling, I believe. Landon, if you want to go ahead and pull that up. So because Odin is with PATH, we're leaning on him to be the primary coverage for the region surrounding PATH, but then also just throughout the east side. So Odin is dedicated to outreach efforts Monday through Friday, and he kind of has broken those into 2 windows of time, in the morning and then the afternoon, where it's from 8 a.m. to 10:30 and then 2:30 to 4 p.m. And then when we go into more specifics of kind of areas in the mornings, he has a route in the mornings and afternoons that he's going to be covering, and that's the immediate area throughout PATH, South Milpas, so that's the Cassie corridor, the underpass, the roundabout, toward the rescue mission, and then down toward the beachfront. Through our planning, actually, this was something that all of the outreach providers kind of came together and decided that this was a need that they were seeing. And so Wednesday afternoons are going to be dedicated to Spanish speaking outreach specifically, because that is something that Odin, in the short time that he's been out in the community, was just really seeing that there's a high need for folks supporting individuals that are speaking Spanish speaking only. And so that is something that he is relying on and partnering with the other agencies, CityNet and Good Samaritan, who have Spanish speaking outreach members. So that'll be on Wednesdays. And then Thursday mornings for Odin, he will be focusing on Chase Palm Park, the waterfront area, and then the railroad tracks as needed. And then kind of supplementing some of the other areas, Monday afternoons, CityNet is going to help support the northern Milpas area. And so that's that 200-300 block. And Good Samaritan and CityNet will both be participating in the Wednesday afternoon kind of Spanish speaking session, because in this planning and coordinating, something that came up was that a lot of this folks, it's scattered throughout the East Side region. It's not just kind of in one area. And so I think to really have that coverage and that support, it's really taking a team for everyone to go out and be able to connect with those folks that are Spanish speaking only. And then Good Samaritan is going to be supporting in the northern part of Milpas, that 200-300 block as well, on a different time than CityNet. So this is tentatively the schedule that was created amongst outreach providers to have that coverage. And again, not having that overlap. So we're duplicating those areas and times and making sure that if we know that one provider is going to be in one area, everyone else can kind of fall back and not have to duplicate that effort, but then still kind of coming together in coordinating the care, as Jonathan was saying, and something that, I was just talking to Anais yesterday about, and it's coming up in all of the conversations that we're having in different regions, is that sometimes, folks, it takes time to build that trust and to engage individuals. And so when one provider can go and interact with someone, they might not be receptive just yet. And so then we can kind of count on another provider that has different tools to kind of engage that individual. And maybe if that's not working there, then we can bring in the other provider as well. And so it's really, because there are a lot of dynamic needs right now on the street that we're seeing, it's pretty amazing to be able to have such a robust team of individuals to rely on one another and to be a part of that system of care, and kind of jumping in if needed when engaging individuals. So and I don't know if Odin or Jonathan, you want to add anything for the schedule there on your end, and just maybe how that's going on your routes.
I don't have anything to add. No, nothing to add at this time.
Okay. And so I know, I think one question is, because we have the city encampment link, and that is the primary way that we are hoping that folks will document some of those areas that we're seeing a lot of impact and just encampments, like we brought up earlier on the Lisos Cacique corner. That is still one of the primary ways that we want individuals to document that, because that goes directly to the city, and then that creates that work order for CityNet to go out and be able to follow up on that, and then ultimately triage to either Good Samaritan or PATH. But I think this is something, if Barbara too, you have some insight of kind of, now that we have a robust team of folks out on the street, kind of who and how that chain of communication should happen.
We've had several conversations among city partners, and CityNet is still our primary within the city jurisdiction, and CityNet has taken the weight of being able to make appropriate referrals to Good Samaritan and others as necessary based on the funding allocation. So until that shifts or changes, that is the process that we're following right now.
Okay.
And then I see Sharon had a question specific to her jurisdiction.
Mm-hmm. And so for the East Beach, I know that is on the route that PATH.
Wants to take them out of there.
Meeting Sebastian. So that is part of a route that Odin does take. So he does go down to the East Beach region, and then CityNet as well does cover part of the waterfront. And so that is specifically to the other areas, that is something that we can work in with the outreach teams specifically to make sure that they are covering, not just going down to East Beach, but then extending over into the bird refuge, kind of hot springs, Coast Village area. But as of right now, it's been more so dedicated to kind of East Beach waterfront area. And so I don't know if, and outside of Sharon's comments, if there are any other questions regarding the schedule or any other questions specifically to maybe CityNet, Good Samaritan as well.
Hi, my name is Sylvia. I'm here with Marburg Industries. You know, I know it was mentioned. I appreciate the work that PATH is doing, you know, with their walkarounds. But I guess this question is for Odin and Jonathan. You know, I know there's a comment in there from somebody that had stated, you know, outside of just the encampment issues or possibly sleeping on the sidewalk, the bigger issue is the substance abuse that's going on in broad daylight outside our businesses here. You know, specifically here at Marburg, it has a huge effect. Obviously, we get quite a bit of visitors here. A lot of them people that are interested in working in Marburg, and you know, unfortunately, we've lost interest from some candidates because of the activity they have seen and them deeming it not safe. And so I'm just wondering, you know, from Odin and Jonathan, when you guys frequent these areas outside of AC Ramirez and Marburg, are you not seeing that activity, or is it being addressed? Because we have been, you know, we have also been told that, you know, these aren't residents, but then we see the residents do go into PATH. So we're just trying to figure out, like, how can we partner up to make sure we address these issues with these individuals that are out here?
Yeah, we're definitely aware of the use that's going on. I think what gets challenging is we can't tell people that they can't use, you know, and so I think that's kind of, but you know, Odin and I are in some preliminary conversations around some of the observations you've made to figure out like how we can, we're discussing some solutions that I don't want to share quite yet, just because I don't think it'd be helpful because it's preliminary, but it's something that we're taking pretty significant note of to figure out if there's some creative ways that we can discourage it. And so I think part of what Odin is actually doing is taking note of people who are breaking the code of conduct behavior outside of the doors, and making sure that's being communicated to our interim housing case managers, so that way they can have the opportunity to address it. but there's some other things that we're kind of looking at beyond that as well to figure out how we can create kind of a safer environment for all of the neighborhood, because we're definitely aware that there is not only drug use, but there are dealers who are coming down and dealing, have been observed dealing as well. And so, it's something that we're taking a close look at and hoping to report back soon.
Thank you. We appreciate that.
Can I add to that too, please? Obviously, I think Pat's role in going out to do engagement efforts is it's a really important part of the solution to this issue. But keep in mind still that drug use, alcohol use in public still against the law. And if it's creating public safety issues and making your employees feel unsafe, then it's an issue for us as well. The police department's always able to come out and address those issues proactively. You can always feel free to call non-emergency, or if it's an emergency, to call 911 on those issues. But we've been communicating with Marburg. We've actually been out there quite a bit. We've made arrests on narcotics. We've made arrests on drug dealers. So we continue to prioritize that area, and hopefully in coordination with what PATH has going on in their outreach, we can maybe mitigate this to some degree. But I want to make sure that you and the rest of the public feel comfortable calling the police when these issues arise.
Thank you. We've definitely done that, and we've seen, the police out here. Some of it, obviously, with daylight savings coming and so forth, it's definitely a concern of ours, coming forward, just because we have quite a few people here at the Cacique location now. And, so we appreciate what you guys are doing. I just, it just seems like, it gets cleaned up and, 4 days later, they're all back again and so forth. So we know it definitely takes a village to help us address the issues. So thank you for what has been done.
Thank you, Sylvia. Sharon, I see your hand is up.
Yeah, I have one other question. This is for Charlie. We were doing outreach this morning around the Hot Springs Bird Refuge, Cabrillo Boulevard area, and just coming in towards the Montecito area, we are seeing a large influx of women. And one of the reasons that they are camping in the area is there's been quite a bit of violence, I guess, in camps in the east side and around the bird refuge. So they're moving further down into Montecito. I think that we experienced a stabbing on Tuesday, right? Just up from the Hot Springs exit. Looks like the victim in this case was the instigator. And so I think it might be worth it if you would be open to it, to get on a conference call with you and the sheriffs and just talk about maybe how to deal with this, because it's right there at that, the juncture of the county and the city's jurisdictions. But I think we're sharing this population, but it does feel like there's a new group that's come in, and they are really aggressive, really pretty violent. And that's what's running the women further south down the track. So I'd love to see if we could team up with you on that.
Yeah, we definitely can. I'm unaware of the stabbing you're mentioning. I'm wondering if that happened in the county, but you're right. A large portion of the area is kind of the unincorporated city area that the sheriff's department handles. But some of that, the bird refuge and some of those locations you're describing, Coast Village Road in particular, are city property. So there should definitely be coordination, and I'd be more than happy to jump on a meeting with the sheriff's department.
Yeah, thanks. It happened on Tuesday, and I think it happened right at Los Patos Way in the bird refuge, and the victim, who was the instigator, ran down to just at Channel Drive, right where the cemetery is, and that's where the sheriffs found him. You guys got the call as well, I believe.
And Sharon, do you want me to take the lead on scheduling that, and you can share your sheriff contact with us? I'm happy to query our folks.
Absolutely.
Okay. I'll follow up with you after the call.
Thanks.
Mm-hmm.
Tina, yep. Oh, Tina, I think you're muted, or we can't hear you.
There.
You're good.
How's that?
Yep.
I just wanted to give a big shout out to Santa Barbara Police Department and their quick response yesterday. As was mentioned around Marburg, as I was driving up 500 Street, there was a man who was just really violent and yelling and throwing things at a Mission linen service worker. I called it in, and Officers responded within 5 minutes. I think the situation was quelled, but that is another area that seems to be attracting people. But I just want to say, good job, PD.
Thank you, Tina. I appreciate that. Yeah, I did hear that call go out. You know, it's really tough. As much as we're struggling with staffing on our end, it makes it challenging for us to respond in the ways that we want to respond sometimes. But what I want to make clear on this RAP meeting, and I try to reiterate this in all the meetings that I can, is that we're ultra committed to public safety and partnership with everybody else on this call. I mean, we all have the same goal, which is long-term solutions to some of these issues that are affecting our community. But if you reach out to me about an issue, what I can promise you is that if I have resources I can send, we will do so. We typically do that on ongoing problems within a day. And like you said, if you call in on something you're seeing right away, our goal is to get there as fast as we can. So thanks for the compliment, and we will continue to do our best to serve the public.
And then I know that there's been a couple of comments and just people's input and feedback around harm reduction. And I think it's a much larger conversation that we can have in an hour. And so I definitely think that, you know, we hear the concerns, and it's something that we can have a future conversation where we just dedicate one of these RAP calls, or invite a lot of partners and individuals to discuss kind of what harm reduction is really looking like in our community and how we can try to mitigate some of those concerns. Because I do think, like I said, it's just with the time that we have left, I don't know how much meaningful conversation that we can have to really address some of these concerns. So I really think that we can, on a future call, dedicate it to that, and then we can really kind of have these conversations around some of these concerns. And I just want to, with 10 minutes left, we do have one update that we'd like to share with everyone, but kind of now that we have this schedule and a lot of teams coming together on the east side, I think, you know, what are the next steps with that? You know, with Odin just starting, I know that there's a lot of areas and concern that we want immediately addressed. And I think to really see the impacts, it's going to take a little bit of time of that consistent engagement, that consistent being out in front of PATH and the shelter, and, you know, talking to those folks that are there that, you know, we need to be kind of supporting and moving along. So we're hoping to, and we're having these discussions of that by name list. I know that that's something that Odin is already taking care of internally to PATH, but I think on a larger scale of what we need for the east side to really coordinate some of that care, it's really all of the providers coming together and trying to create that mapping of the area and understanding who's there, and then being able to cross-reference that with, you know, our HMIS, CES access, and looking at who is connected to what and how we can better connect those services to the individual that may have lost connection to someone, and then identify those folks that aren't connected to those resources at all. So that is a conversation that we are having offline right now, of figuring out what is the best avenue to create that by name list. And really just kind of, what does that look like for a community? Is it a full by name list, or is it a top 5, top 10? We've seen that model really be supportive throughout regions on State Street and other areas of, if we have that by name list of those high acuity folks that need the most support, that are really impacting the area, that we can really make a difference when we know who they are and exactly what we need, and we can start planning and coordinating around their needs. So I think that that's something that we're going to be working on, and we'll be presenting once we kind of established how we're going to be able to track that by name list. So that is kind of the next steps, and we look forward to sharing with all of that with you. And then, oh, I don't know, Barbara, you were going to say something.
Yeah, I just want to speak to a couple of things and general updates. The first is, you know, the comments per harm reduction. So we did have a session, I think about a month ago, with trauma-informed approaches and harm reduction. I think the individuals on this path are exceptionally knowledgeable about the approaches that are taken by our service provider partners. We also need to delineate, like Lieutenant Katsapas did so very well, is that it's illegal to use drugs and consume alcohol publicly in the city of Santa Barbara. And so we understand the approaches of our nonprofit service provider partners and support those approaches. But when it comes to being in public, impacting our neighborhoods and doing and undertaking that illegal activity, we will commit to enforcing that. So I want everyone on the call to hear that, and we're doing everything we can in coordination with everyone on this call to make sure that our city is both safe and vibrant to live in. And I appreciate the patience. I appreciate the ongoing communication. But please know we are committed to both ensuring safety and vibrancy, as well as supporting individuals and getting the care that they need and getting that care long term. The second thing I want to mention is that we are scheduled to discuss both the contracts with SB Act and our third year of a 3-year strategic plan to address homelessness and its impacts in the city, as well as the PATH contract that we have that will be now specific to acquiring and making sure that we have beds available so that when we are out and about, both service provider partners as well as law enforcement stakeholders, that we can offer shelter and know that those beds are available at any time. So we'll be speaking to an update on both of those before City Council on Tuesday. There is a very significant agenda item before that on police oversight. We expect it to be a longer meeting. So if you're available to jump on maybe 3:30, 4 o'clock, 4:30, we expect to be talking about homelessness at that time. And again, any questions related to neighborhood impacts, neighborhood improvement, we've started an informal monthly coffee meeting on Wednesdays, the first Wednesdays of the month at 9 o'clock. There's a number of folks that show up regularly, but you're more than welcome to join us if you can. That's, discussing anything from streetcar vendors to making sure that the appropriate signage is available to litter and large debris removal. So if you have any concerns related to neighborhood improvement and impacts in general outside of homelessness, whether they're associated with homelessness or not, please feel free to send those to me directly.
Thank you, Barbara. And then Susie, you jumped on. I don't know if it looked like you wanted to say something.
Hi, good morning. I know Sylvia Nzweta, who's on my HR team, has been providing information this morning as well. This week has been quite active in terms of some ODs and individuals camping out again in front of our driveways and fence lines. So appreciate everything that Charlie, your team is doing and trying to get more of a presence. One recommendation might be if some of the businesses on Cacique, if we could form a consortium and get some additional security to, or some, mental health resources support to get these individuals off the drugs and into some, support group homes or, some additional resources, because there is a lot of drug use going on right now. And it's, we had quite a few new hires and trainings going on. And it's quite disturbing for our new employees. So whatever we can do as a team, I know it takes a village and working together. I'd love to partner with whatever we can do.
Landon and Catherine, can we make a note of this for the all-call wrap? Because this is across every neighborhood that we're seeing more drug use, more criminal activity, just more behaviors that are not necessarily conducive to outreach and service provision, and how we can work together to try to address that and resources that are available. I know SBPD has information now on a card for substance abuse treatment and recovery because they're seeing an uptick in that level of behavior. So I just want to note it for a future I'll call. I think Susie's offer of how can we work together with business owners to address this and address it holistically is a great suggestion.
And with that, our next all-call wrap will be on Wednesday, October 19th at 3 p.m. So we'll make sure and send that out. But thank you for that, Barbara.
Well, and that was our discussion today that we had. So I really appreciate everyone being here today. And we hear every one of you. And I think with what Susie was just talking about, I think it's a good plan forward. And it's definitely something that we're going to take into consideration and really plan around. And so we hear every one of you, and we really do appreciate everyone's feedback. And I really would just want to give a shout out to the outreach providers again, Odin, CityNet, Good Samaritan, Anais and her team. Just working with you offline has been really great. You all have been such a pleasure to work with, and just seeing you all work together just so quickly and smoothly it's been really amazing to see. So kudos to you all and the hard work that you're doing. And thank you all, and I hope you have a great rest of your Friday and a great weekend, and then we will see you all soon.
Thank you.
Take care, everyone.
So, Sylvia, let's